uh,
Yes, sir.
good evening, everyone. Thank you, everyone, here for joining the English session. And
Please,
today
please
is
open
our
your video.
actually,
Please open
sir.
your video.
Yes, sir. There is no internet problem, so my video is not available. It is our 1958 day of uninterrupted daily webinar of IFPH for promoting homeopathy. And our today's guest, Dr. Pankaj N. Lathia, MD Homeopathy and Ph.D. Homeopathy, HOD and Professor, Department of Community Medicine, Ph.D. Guide, VHMC and RC, Anita KIM, Chief Consultant at Om Homeopathic Clinic F4, Satsang Complex, opposite Pushchidham Haveli, Surat. Now, Sir has more than 15 years of clinical experience, teaching experience, 13 years, and presentation. He has given many presentation on homeopathic subject and cases, and written various articles in different magazines, and winner of many awards. Dhanvantri Award winner since 2022 three times, and judge for some of the leading schools as an expert for various schools. And his topic is decoding dengue fever, clinical recovery, and hematological gains in a retrospective homeopathic study. Okay, and now, uh, sir, you can start your presentation.
Okay, madam. Good evening. I'm trying to share my PPT.
Sir, please unmute yourself.
Yes, madam. Are you able to
Okay.
hear, madam?
Yeah, sir.
Okay, madam.
Okay, sir, you can continue.
Are you able to see, madam?
Yeah, sir.
Can I start?
Yes, sir. You can continue your presentation. Sir, please continue. We
Okay.
can't able to hear you.
Okay. So, good evening, everyone. Today's topic is decoding dengue fever, clinical recovery, and hematological gain in retrospective homeopathic study. So, I'm going to start with introduction. The global burden of dengue fever has increased markedly over recent decades, establishing it is a major mosquito-borne viral illness endemic to more than 100 countries, particularly in tropical and subtropical regions, while a substantial proportion of the infection remain mild or asymptomatic and underreported. Symptomatic dengue commonly present with acute febrile illness is accompanied by headache, myalgia, arthralgia, nausea, and occasionally rashes. Current public health strategies primarily emphasize vector control and community-based surveillance, while clinical management remains largely supportive, focusing on antipyretic therapy and careful fluid management to prevent complications such as hemorrhage and shock. In India, homeopathy is widely employed in the management of acute febrile condition, including dengue fever. Homeopathic treatment is individualized and guided by the totality of symptoms with the objective of stimulating the body's intrinsic healing responses. Certain homeopathic medicines, such as Carica papaya, have been explored for their potential role in supporting hematological recovery, particularly platelet stabilization. Retrospective evaluation of dengue patients managed with homeopathic medicine may therefore provide meaningful insights into pattern of clinical recovery and changes in hematological parameters. A range of homeopathic remedies may be indicated in dengue fever depending on the patient's overall symptoms profile. disease intensity, and constitutional characteristics. Commonly utilized medicine include Eupatorium perforatum, Bryonia, Chalcemium, Rustox, Aconite, Belladonna, Arsenic. Remedy selection is based on comprehensive case analysis encompassing physical manifestation as well as mental and emotional attributes. Such retrospective analysis contribute to a better understanding of remedy utilization trends and their association with clinical and hematological outcome in dengue fever. These all are the remedy which are useful in case of the dengue: aconite, arsenic, belladonna, bryonia. I don't want to go into detail in therapeutics because we will see various cases: Carica papaya, Eupatorium, Gelsemium, Rustox. Review of literature. I have taken two review: Elegoda J and Elegoda PJ, dengue fever treatment through homeopathy, a case reports on individualized medicine and symptomatic recovery. Content. Across homeopathic literature, there are multiple reports and observational study examining the role of individualized homeopathic treatment in dengue fever. Case reports and series emphasize symptomatic relief and supportive recovery, often noting improvement in fever, malaise, and overall well-being with individualized remedy guided by the principle of similarity. One recent case report discussed the clinical course of dengue patients managed with homeopathic treatment, underscoring rapid symptomatic relief and recovery trends following individualized medicine. My second review: studies on the effect of Carica papaya mother tincture in dengue associated thrombocytopenia, International Journal of Homeopathic Science. One notable interventional study published in the International Journal of Homeopathic Science investigated the effect of Carica papaya mother tincture on thrombocytopenia in dengue patients. In this experimental study of 50 cases with low platelet count, administration of the Carica papaya mother tincture led to gradual increase in platelet counts over 2 to 3 weeks, suggesting a potential beneficial effect on thrombocytes recovery in dengue associated thrombocytopenia. My aim and objective: the present retrospective study aimed to evaluate clinical recovery patterns and hematological changes in dengue fever patients treated with individualized homeopathic medicine. Materials and methods. Types of study. I have used observational retrospective study. Source of data: I have taken cases of my private clinic, homeopathic clinic. Materials: case record perform of my clinic. Sample size: I have taken 30 dengue cases. Selection of criteria. Inclusion criteria: patients with laboratory confirmed dengue fever, dengue DO test positive, individual belonging to any age group, patients of either sex. Exclusion criteria: patient presenting with severe form of dengue, including dengue hemorrhagic fever or dengue shock syndrome. Patients with pre-existing chronic hematological condition that may influence platelet count and pregnant women. Response analyze. I have analyzed follow-up in three criteria: significant improvement, moderate improvement, and no improvement. Significant improvement means symptoms resolution with stable clinical condition and improved hematological parameters using only homeopathic medicine. Moderate improvement, partial clinical and hematological improvement requiring Carica papaya mother tincture, intravenous fluid, and paracetamol along with homeopathic medicine. No improvement, absence of clinical and hematological improvement within 24 hours of treatment initiation. So I would like to share few cases with you. Case 1. Mrs. Didi, age 45 years, had complaint of viral fever before 10 days and started allopathic medicine. After that, all complaints were better, but patients feel too much weakness after episode of viral fever since 10 days. Patient came with complaint of fever with chill aggravated by AC3 mark, along with this body ache, headache, eyeball, small joint pain, and pain over vertex, throbbing type of pain with severe weakness. Patient was not able to sit even for 5 minutes. She had to lie down in waiting room and wanted to take rest. These are the complaint of the patient. Physical general: appetite decrease, no desire to eat, thirst frequent, half to 1 glass, warm water. On examination, BP and pulse within normal limit, temperature 100 Fahrenheit, tongue white coated, and throat dryness 2 mark. I advise for CBC and dengue duo. You can see there are there were WBC 2300 and platelet near to normal. So I have seen in my clinical practice in first and second day in investigation, in laboratory investigation, there will markedly change in the WBC, but platelet near to normal. So first change is criteria, that was WBC. This is a dengue duo test positive, IgG, IgM, and NS1. All three are positive. Totality of symptoms: weakness, 3 mark, thirst, frequent for warm water, and throat dryness. Okay, anyone can say which remedy are you thinking? Anyone? Please.
So, Eupatorium
Message.
perforatum.
Okay. Anything else? Anything
For
else?
joint
Anyone?
pain, Restox.
Everyone can
Okay.
write in chat box.
Okay. You can write in chat box. Arsenic alp. Okay. Very good. Anything else? Okay. Let's see. So weakness 3 mark. Thirst, frequent for warm water, and throat dryness. There are 3 to 4 remedies are near to case, but on the basis of weakness out of proportion, because patient can't sit for 5 minutes. She totally lie down in my OPD. She were not able to. Totally, she was not able to sit. Within 5 minutes, she wanted rest. So on the basis of out proportion of the weakness in compare of intensity of disease and thirst frequent for warm water, I prescribe medicine arsenic alp 33 pills 4 hourly for 2 days. Advise to take rest and plenty of oral fluid. Let's see what were all the changes. After 2 days, complaints of fever on and off, appetite improved, weakness improved. When patient feels better, in parallel, their investigation also will be improved. This is a totally clinical improvement sign. If patient feels better from inside, then your report should be improved. So you can see WBC 3200 means improved WBC, but platelet decrease. I have seen in my clinical practice, and also this is a common clinical lab investigation. Platelet are decreased for 4 to 5 days in case of dengue with treatment. So don't be disappointed when your platelet decrease in second or third report because it is a common clinical lab investigation sign. Okay. Follow up 2. After 2 days, complaint of no fever, better, patient is improved, and platelet you can see 2,17,000 and WBC 4,400 means both are improved. So I prescribe arsenic alb 200 one dose. State. After 4 days, no any complaint, patient feels better. You can see WBC 6,800 and platelet 3,97,000. So patient totally recovered with help of arsenic alb, and also patient's reports totally improved. Okay, let's see case 2. LDR age 85 years. Chief complaint: patient had complaint of high grade fever with chill and rigor since 1 day. Severe headache with persistent fatigue. Patient report see sir, there were end of monsoon, so cold and damp weather aggravating patient's joint pain. Next, stiffness and warm application relieved. Generalized weakness.
Hello, sir. Your voice is breaking. Can you check your net
Urinary
connection?
habit not. Yes, madam.
In between your voice na breaking.
Oh, because of network problem, madam. Okay.
Okay,
Now
sir.
are you
You can continue.
okay? Okay. Thirst not significant. Bowel habits not significant. Urinary habits not significant. Vitals blood pressure 110/70. Pulse 90 per minute. Temperature 99.8. Respiratory rate 18 per minute. SpO2 97%. Systematic examination not any significant data. I advise for CBC and dengue duo. You can see platelet 36,000. Only 36,000 platelet. So I have started and dengue NS1 positive. So on the basis of totality, severe body and joint pain aggravation, rest, cold temperature, neck stiffness, which is relieved by warm application, and high grade fever with chill and weakness. Anyone can say which medicine are you thinking? Yes, please write in chat box. Okay, Rustox, Bryony Alba. Okay, anyone? Rustox, Bryony Alba. Patient is 85 years old and with 36,000 platelet. So we can put this patient under the high risk group. This is not a simple dengue. We have to think about risk factor and also for complication. Okay. Majority people are saying Rustox. Okay, let's see. On the basis of joint pain, neck stiffness, high grade fever, I have prescribed medicine Rustox 30 every 4 hourly with Carica papaya mother tincture 20 drops TDS and paracetamol for SOS in high grade fever. So why I have prescribed medicine with Carica papaya? Because Carica papaya is a good mother tincture for increasing platelets. So whenever patients came to my clinic with platelet below 1 lakh, then I have started constitutional medicine, acute remedy with mother tincture. And also I prescribe paracetamol for SOS fever because patient age is 85. So it will be helpful to relieve the symptoms immediately. Otherwise, I will not prescribe paracetamol to any patient. After 8 hours, patient's condition deteriorate, BP low, temperature 103, and SpO2 96%. With Carica papaya, with Rustox and paracetamol, patient condition worse. So I referred this patient to my friend's general practitioner clinic and started IV fluid with homeopathic medicine, mother tincture, and SOS paracetamol. Only I have started and add IV fluid in this patient. But you can say on second day, no improvement noted on second day, condition worse, patient referred to higher center for further management. I have referred this patient to Narayan Hospital and with allopathic treatment. On the second day, platelet count 33,000 from 36,000 means still platelet are decreasing. On third day, third follow-up, after 2 days, third follow-up, condition worsen clinically and hematologically. You can see with all allopathic treatment, IV fluid in ICU, patient platelet to only 12,000. So definitely this is a virgin condition. Okay, now we start with SDP. Dr. Devendra sir started SDP single donor platelet. After two platelet, all reports have started gradually increase platelet and improve the all report gradually. So this is the my failure case. First case was successful case, and this is my failure case. So I'm very in when then with your colleagues So they also can learn from your failure case. Okay, 29 years. Okay, a 29 years old patient presented with acute onset fever associated with rigor since 2 days, accompanied by severe body ache and headache, busting type aggravated by motion 3 mark, even with movement of the eyeball, fever on and off associated with chill and rigor, body ache severe during febrile episodes, abdominal pain continuous, dull aching in nature, bowel habits stool not passed since 3 days. Physical general, thirst increase, desire for cold water, appetite no significant change, sleep drowsy and sleepy, patient wants to be lie down and is doesn't like to do any work. On examination, temperature 101 Fahrenheit auxiliary, pulse 94 per minute, tongue white coated and dry. I advise for CBC and dengue DO. You can see platelet count 1,06,000 only, and also SGPT 117. Albumin present in urine. Dengue, IgG, IgM positive, and CRP 20.4. The totality of symptoms: bursting headache, aggravation by slightest motion, fever with chill, rigor and body ache, prostration with desire to lie down, thirst for cold water, and constipation during acute illness. Okay, anyone can say which remedy? Yeah, okay. Anything else? Okay, anything else? Brionia?
അതെനിക്ക് തോന്നുന്നു മറ്റേ അപ്പച്ചി കൊണ്ടുവന്നാന്ന് തോന്നുന്നു.
Okay, let's see. मैडम किसी का माइक शुरू है. Okay, I have prescribed Brionia alba 30 4-hourly for 2 days and advised to take rest and plenty of oral fluid. After 2 days, you can see complaint of fever on and off, bowel habit improved, weakness improved, and platelet count 1,12,000 means improved from the 1,06,000. Okay, SGPT decreased 92. Again, I repeated Brionia alba 30 TDS for 2 days. After 3 days, complaint of snow fever, patient is better, and Brionia alba 200, 2 doses BD I prescribe. You can see report WBC normal and platelet count 2,86,000. SGPT still high, but gradually it will decrease. Mr. AD, age 47 years, non-case of all joint pain, bursting emulated by pressure, forehead heaviness emulated by pressure, fever without chill, patient required thin covering with fan, dry coughing 2 mark. Physical general, appetite decrease, no desire to eat, thirst, drink at long interval. On examination, BP 140 by 90, pulse 90 per minute, temperature 100.6 Fahrenheit, tongue clean and throat dryness. I advise CBC, urine and dengue DO. You can see platelet count 84,000. 84,000 platelet count. Also, pus cell 223 in urine. Dengue, IgG positive. This is the totality. Thirst for long interval, joint pain, bursting type emulated by pressure, forehead heaviness emulated by pressure, and dry coughing. Okay, anyone can say which is indicated remedy? Please write in chat box. Bryonia alba. Okay. Anything else? Bryonia. So I prescribe pills 3 hours for 2 days and advise rest and plenty of oral fluid. After 2 days, complaints of snow fever, appetite improved, patient feels better. You can see platelet 89,000 means slight increase. In previous report, there were 88,000 and now 89,000. Bryonia 34 pills 6 hourly. I prescribed and advised for CBC after 2 days. But patient came on 7th August. Again, he started feeling weakness and feverish feeling along with pain on the right side of the abdomen in hypochondriac region. So I advise for USG abdomen. I advise USG abdomen. USG abdomen shows that liver parenchymal disease, bilateral reducible inguinal hernia, and slight thick wall urinary bladder. But liver parenchymal disease, that was important because patient already known case of portal hypertension with liver parenchymal disease, and this patient is alcoholic. So again, this patient we can put under the high risk group. After this USG report, patient advised for CBC, prothrombin time, and LFT to evaluate any platelet reduction and liver abnormality. You can see platelet count 1,32,000 means increase after 1 week, but prothrombin time also increase 16.28. Liver function test, you can see serum alkaline phosphatase 175 means now patient feels better, no fever, but because of abdominal pain and inflammation over the liver, I referred to the gastroenterologist because of the are you able to hear, sir?
Yes, yes. Now we can hear you.
Madam, are you able to hear?
Yes,
Okay,
yes.
Yes,
okay.
sir.
This is
Yes,
last
sir. You
case.
can continue.
Okay, 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 okay. Sorry for interruption. Okay. So severe joint pain and body ache. Child was unable to remain in one position due to pain. Disturbed sleep. His father reported the child keeps moving his leg continuously while lying down. I feel that he does this due to pain. During sleep, screaming, weeping, and starting. Temperature 101 Fahrenheit, pulse 110 per minute. You can see WBC 3600, platelet still normal, 2,13,000, but WBC increase. I previously told you that I have seen in dengue patient there see dengue IgM positive, IgG negative or NS1 negative, but IgM positive. So this is a dengue patient. Totality of symptoms: mark restless due to pain aggression during rest and while lying down, relief from motion, fever with chilliness and severe body ache, disturb sleep with screaming, weeping, and starting during sleep. Okay, anyone can say? Remedy is very clear cut. Income met, Rustox, okay, Rustox, okay, okay. Let's see. I have prescribed Rustox 32 hourly till 50% better. Because of severity and joint pain, I repeated medicine at every 2 hourly till 50% better and advised to take rest and plenty of oral fluid. Follow-up one, within 24 hours, body ache 30% improved, sleep 50% improved, and temperature 99.4 Fahrenheit. Follow-up two, after 3 days, patient showed marked clinical improvement Laboratory investigation also showed improvement. You can see platelet count still normal and WBC 5,300. So data analysis, homeopathic medicine administered in dengue cases. I have prescribed Bryonia alba in 10 number of patients, and out of 10, 9 patients was improved and 1 case is not improved. Rustrox in 7 number of cases and 5 improved, 2 not improved. Eupatorium in 5 cases and 4 improved, 1 not improved. Arsenic alb prescribed in 3 number of patients and 2 improved, 1 in 2 patients, 1 improved, 1 not improved. Econite in 2 patients, 1 improved, not improved, 1. Belladonna I have prescribed in 1 patient and I didn't get any result. So I prescribe homeopathic remedy in 30 number of the patient. Out of 30, 22 cases improved with the homeopathic medicine and 8 patients I referred to other center. So you can see graph. So most important remedy in treatment of the dengue, Bryonia alba, first number at the first number, and second on the second number, Rustrox, Eupatorium on the third number, arsenic, gels, Econite, and last one, Belladonna. Distribution of the dengue fever with cases by treatment given. I have prescribed only homeopathic medicine alone in 20 number of cases. Out of 20 number of cases, 15 improved only with homeopathic medicine, and I have referred 5 patients to another center. I have prescribed homeopathic medicine plus Carica papaya mother tincture plus paracetamol for high grade fever to the 7 number of cases. Out of 7 cases, 6 cases, 5 improved and 1 I have referred. I prescribe homeopathic medicine venous fluid, IV fluid, in 4 number of cases, 2 improved and 2 referred. So in this way, out of 30 cases, 22 improved with homeopathic medicine alone, homeopathic Carica papaya mother tincture plus paracetamol, and in few cases homeopathic plus fewer cases by treatment given. You can see homeopathic medicine alone can treat easily all. Okay. Okay, so homeopathic medicine alone can treat the all the dengue patients. Clinical outcome of dengue fever patients. Clinical output. I got significant improvement in 15 number of cases, moderate improvement in 7 number of cases, no improvement in 8 number of cases. You can see only with homeopathic medicine we can easily treat the dengue patients. Discussion. This retrospective analysis evaluated remedy utilization patterns and clinical outcome in 30 patients with dengue fever treated with homeopathic medicines. Most patients demonstrate clinical improvement marked by resolution of symptoms and stabilization or improvement in hematological parameters. 15 patients responded favorably to individualized homeopathic treatment alone, while 7 required additional supportive care and 7 were referred following clinical deterioration. Remedy selection was guided by the totality of symptoms. Although limited by its retrospective design and small sample size, the study findings indicate a potential supportive role of homeopathy in the management of dengue fever, highlighting the need for further well-designed clinical studies to substantiate this observation. Conclusion. Evolution of remedy utilizations and clinical outcome indicates that individualized homeopathic treatment may be associated with symptomatic relief and maintenance of stable hematological parameter in case of mild to moderate dengue fever. Nevertheless, larger and methodological robust prospective studies are required to confirm this observation. These all are the references which I have taken during my study. Okay. Sorry to
Hello, sir. We have left 15 minutes, and if you have few more cases or you can share something else about dengue fever, like its prevention, uh, what we can, what are the measures we can took for prevention. If you want to share something like this, can. As we all know about dengue fever, dengue fever is spread by mosquito, Aedes mosquito, and the fever is so high and body aching, platelets go down. So, for a homeopath, dengue fever is a challenge to treat. As we go through the treatment, uh, we have to check the parameters as sir told about platelet count, WBC count, and in starting, uh, as the patient come to our clinic, we have to prescribe according to the symptom like fever, restlessness, body ache, and thirst. And after that, if patient improve and he feels good, as I told us, if patient feel good from inner side, then we check the further parameter, that is blood count and NS1. If NS1 positive and IgG and IgM positive, then according to the hematological reports, we have to give medicine like papaya for increased platelet count, for increasing platelet count. So, but we have to know the prevention also. Like prevention is better than cure. Like we can educate the patient, like eliminating standing water, use mosquito repellent, to aware the society also. If anyone has any question to Dr. Pankaj, they can ask.
Dr. Pankaj is muted now.
Yes, anyone, any question?
Sir, what kind of diet you used to advise?
Hello.
What kind of diet you used to advise?
Sir, actually, I advise only soft diet, but I advise plenty of oral fluid, Mosambi juice, lemon juice, coconut water. Base of my treatment, plenty of oral fluid.
It is better to give some eggs because that the protein content will increase the production of platelets. That's what I would like to add.
Okay, okay, sir. Okay. Thank you, thank you. Okay, anyone?
I still remember a case that is my own case when I was
Hello.
having this.
Am Arif?
Can you hear me, sir?
I think, sir, here major network
Network
issue.
problem is there. Yes. So I'm not talking. Dr. Jolie, can you add something on experience in?
I am very sorry. Next time I will take out major network issue, sir.
Yes. Dr. Jolie, can you share some of your experience in treating such cases?
Can you hear me?
Yes.
Sir, that when a first attack of dengue to a person, if it is the treatment is easy, because that first attack that the body can easily cure by any medicine. But if that same person have a second attack of dengue, that is the real problem of that complications. That is why that we cannot treat that our doctor told Rastox with Rastox, one case failed, 9 case okay. That failure is because that it was the second attack of dengue. So if a patient with a first attack of dengue, we have to be more careful when it goes to second attack. So that the duration between first attack and second attack is very important, and we have to give that dengue cured person with preventive medicines also with asthmatic or and all the precaution has to take to prevent second attack. That is a real problem of incurable and complications of dengue. Then the second attack, there is bleeding, internal bleeding, and very low platelets. And internal bleeding is the complication of second attack in one same person. That is, we observed that case. We observed dengue. Is it correct, sir? Dhanesh, sir?
Exactly, you're 100%. We can ask about, yes, yes, Dr.
So,
Pankaj.
so we
You can.
always careful whether it was first attack with IgE and IgM. We can whether it was early there was first attack. So always tell the or aware of that person and family to avoid second attack to that person. If second attack, it will be very very danger. That is a very very serious observation we had all done. So there is a preventive measures has to given to 1 or 2 months to prevent second attack. Is it correct, sir?
Dr. Pankaj, can you share some of your experience in that way?
That one experience that one person from Madras came to us, and that two other person died. There were other state. Their home was at other states, but it Vadakancheri in Kerala we treat that case, and that patient escaped, and they told that I only escaped and my two friends with we both third or infected same, and that two persons died. But I told and he escaped. But I told him never a second expose has to never avoid second exposure, and but they don't they cannot avoid second exposure. So I gave him Rastox 0/3, that keyword 0 bar with rest of 30 carica, as we already discussed, carica papaya tincture, rest of 30. That but I gave him as a preventive measure Rastox 0/3, one pill daily for 1 month. Then there was no second attack. Then that health inspectors also in one of our discussion, health inspectors also insist that we should know whether it is a first attack or second attack with the test of IgE or IgM, as our madam told. So always you have to check IgE and IgM of dengue. Then only we have to go for platelets and okay, WBC. And the platelet has to rise and WBC has to increase with our medicine. It will be done with Carica papaya, I think Avena sativa. And Dr. Danesh, would you told that protein food is highly important, and we are giving them green gram. പുഴുങ്ങിയത് green gram, boiled green gram without oil, and that rice kanji or that some uh, millets, so that person immunity will increase also. You always tell the patient that never go for a second infection. First infection is
Excellent.
very easy to cure. Second infection is
Excellent.
very.
Excellent information, madam. Now, Dr. Shaji, could you want to say something?
Thanks, sir. Thanks.
Let us wait.
Hello, good evening. I apologize that I came little late, but since it is a dengue hemorrhagic fever, which is very important in my life also, because I am in Philippines, I am talking to you from Philippines, and that disease was very prominent here during my early years in Philippines, introducing homeopathy here. So there was an epidemic in 1998 period where in a city where I am living and practicing at that time, it was killing so many people. So there came a scarcity of blood transfusion, and I am just initial 3 years of my practice here in Philippines at that time. So I started to get a few of my dengue initial cases, and fortunately, by grace of God, I was able to treat and cure all my dengue fever patients, nearly 100 of them. And what the philosophy I approached that lead to such a state was, um, first of all, I never suppressed the fever by giving paracetamol or any paracetamol compounds. And that is very important because most of the viral infections get complicated by suppression of fever. That's why in fever cases, many deaths happen in allopathy hospital mainly because of suppression of fever, by which the toxicity of the virus or the bacteria affect the respective organs. In case of dengue hemorrhagic fever, it affects the platelets. So the moment we suppress the fever, which is actually a protective mechanism to prevent the chemical reactions between the toxins released by the microorganisms and the functional ingredients of our system, because in a human body, the normal temperature is maintained to facilitate all the biochemical reactions. When the toxicity increase in our body, the toxic chemical reactions also happen in such a temperature. So increasing the temperature and shifting the optimum temperature for biochemical reactions in our body by creating fever is a protective mechanism. By giving paracetamol, we are neither destroying the microorganisms nor detoxifying the toxins. So it is simply acting at the hypothalamus and making it dysfunctional regarding identification of toxicity in our body, whereby decreasing the temperature. By doing so, we are allowing the toxins to act on our body. So different viruses has different targets of their toxicity. In dengue hemorrhagic fever, it affects the platelets. In rheumatic fever, it affects the valves of the heart. In chikungunya, it affects the joints like that. So in my case, I always took a precaution never to suppress it, and that for me is one of the important reason for my almost 100% success. Then another important thing is if you allow fever to sustain, we need to take care of two important factors. One is to provide water. As the fever sustains, the evaporation of water happens. So we need to provide water, plenty of water for the patient to drink. And if the patient has nausea and vomiting or loose bowel movements as part of the problem, then we need to immediately place IV, intravenous fluid, to replace the lost fluids. Then one more thing is, to maintain the fever, still the body's immunity react and detoxify our toxins, we need to provide nutrition to maintain the fever, because fever is maintained by increasing the metabolic rate and converting the energy produced into heat energy. So the nutritional supply should be there. So for that easily absorbable form of energy, nutrition should be provided like glucose water. Also, in case of nausea, vomiting, or difficulty to provide nutrition from outside, then we need to immediately give IV fluids to provide water and nutrition. So these are two important things we should always notice, take note of. Then regarding the
Hello.
medication, yes.
Time is over, so we have to hand over to Malayalam session.
Okay, just one more moment. I will complete this. Just one more point.
Okay, sir.
So,
Sure.
medication, we need to give the appropriate medicines plus an anti-hemorrhagic medicine. In my case, the medicine mostly indicated in Philippines at that time was millifolium tincture, which I used to give, which give good results in increasing the serum platelet count without blood transfusion. So, in none of my patients, we required blood transfusion for platelet increase. We all done it with our medicines alone, and that was a big surprise for the people and all of the doctors here. Thank you. Thank you.
Dr. Etita, you can say what thanks also to Dr. Pankaj.
Okay, sir. Thank you so much, Dr. Pankaj Lataria, sir, for a nice presentation and you share so many cases about the dengue, where we have to go for hematological reports and in acute viral fever, we have to give Restox like Brimia. It's such a beautiful and nice presentation. Now the time is over. We have to hand over to the Malayalam team.
Okay.
Thank
Okay.
you.
Thanks a lot, madam and sir. Thank you. Thank you.